The dreaded MRCP Part 1 is often described as junior doctor working life's worst nightmare. Given that it's the first exam after the medical school exams, some doctors even contend that it is the hardest challenge to overcome. And if you haven't studied since then, prepare for a rude awakening. Certainly, I awoke. I passed MRCP 1 in the first attempt, working as a full-time trainee and with a family. If I could, you can as well. Here are my 6 top tips for you to ace this exam in minimum time with minimum effort. Number 1. Planning. Benjamin Franklin said, if you fail to plan, you're planning to fail. Set aside at least 2 and ideally 3 months for preparation. Look up the exam dates that most suit your circumstances. Once you have selected, throw your head down and start grinding. Make a habit of studying at least 2 hours every day, no matter what, and 5 hours on the days off. You're allowed to take a day off only on your long calls. Number 2. Study resources. Here are 3 essential resources. A. The only MRCP notes you will ever need by Hani Abul Qasim. B. Passmedicine question bank. C. Passtest question bank. You can get free copy of only MRCP notes online. For question banks, you can either buy them at a local bookstore or you can find the free PDF versions by racking the internet to find the free hosting sites, or better, you can subscribe to them on the official websites. Personally, I bought the Passmedicine question bank from a local bookstore and the Passtest question bank, I subscribe to them online. I like the Passtest MCQ pool because the MCQs are quite complex and they actually reflect the true nature or the true degree of difficulty you're going to experience in the actual exam. Number 3. Studying effectively. The only MRCP notes you will ever need is your core knowledge book. This contains explanation from Passmedicine question bank pool organized by specialty in a textbook way. Follow these steps and I can guarantee you passing like a breeze. Step 1. I would recommend reading 1 chapter at a time from the only MRCP notes you will ever need, say cardiology, renal medicine or rheumatology. Once you have finished the chapter, go to the Passmedicine question bank pool and solve MCQs pertaining to that chapter. Now finish all the book and the Passmedicine question bank pool this way. Any new valuable information you find in the question bank, scribble it back on your only MRCP notes. Step 2. Once you're done doing all that, now revise only MRCP notes from beginning to the end. Step 3. Now go to your Passtest subscription, randomly solve the questions from the Passtest online. By doing so, now you would have gone through from about 4,000 MCQs. At this stage, you would have gained enough knowledge, and now in the next step, you just need to stabilize this information. Step 4. I can't emphasize how important this step is. Now you just have to sit and revise only MRCP notes you will ever need. Solving the MCQs till the end is not recommended. The more the reads of the only MRCP notes, the better. I personally did about 2 to 3 reads before appearing in the exam. Step 5. You are ready. Relax and appear in the exam. Number 4. Breaking down the numbers. Let's examine the MRCP 1 format. A typical question could be, a 45-year-old woman presented with right flank pain. She had a 4-year history of hypertension and progressive cognitive impairment. On examination, she had livido reticularis and tenderness in the right flank. Her blood pressure was 185 by 105 millimeter mercury. Urine analysis showed blood 3+ and protein 1+. Investigations are as follows. What antibody test is most likely to be positive? Each year, MRCP UK dedicates a specific number of questions to each specialty to ensure coverage of the entire IMT curriculum. Recently, this has been divided as follows. The inability of the applicants to efficiently manage their time is the key reason for their failure. Remember that not all specialties are created equal. For instance, everyone is aware the respiratory medicine section is where all the fun at. Let's review the distribution once more, where cardiology has got 14 marks to them, oncology has just got 5 marks. This is crucial to consider. How much time can you spare then? Knowing that the exam is going to be next 60 days isn't very helpful, especially if your placement is very busy and you've got an upcoming long shifts of nights or days. Let me give you a more practical and easy way to measure time. Sit down and think how many hours you can actually effectively spare for your exam. Now divide the total number of marks in the exam by the total hours you have got. For example, part 1 is worth 200 marks, and if you can realistically fit only 100 hours in the next 2 months, then you should allocate 1 hour every 2 marks or 30 minutes for every mark. Referring back to the table, pharmacology roughly comprises 15 of the total 200 marks, and therefore theoretically you can afford to spend 7.5 hours of your 100 hours on the subject. That's not a lot of time for one specialty when you factor in the number of practice questions available. Nevertheless, the 100 hours for studying is a lot of time. Unfortunately, that is the MRCP dilemma. Accordingly, even if being a cardiologist or a gastroenterologist was your lifelong dream, you can only spare roughly about 7% of your time preparing for it. This is how you must maintain your discipline, or you risk discovering that you have completely neglected the other areas. This is how I studied, and I found it very valuable. But this is just a rough guide. Everybody is different with their own unique strengths and weaknesses. You might want to change the time allocation depending upon yours. Number 6, on the day of the exam. MRCP 1 is a single day exam. It consists of 2 papers, 3 hours long with 1 hour break. Night before exam, make sure you sleep well and early. I would recommend get in habit of sleeping early a week before so that you can easily fall asleep on the night before the exam. Arrive at your center at least 30 minutes early before the start of the exam. And if you're like me, running late everywhere, I would recommend putting an hour extra arriving early so that you don't have to panic. Bring lunch with you because there are not going to be any refreshments provided. Cruel, isn't it? Don't over caffeinate, as the bathroom breaks will eat up your essential time. Number 7, attempting the MCQs. I have always done well in MCQs exam, and here is the open secret. There is no negative marking, so attempt all the MCQs. Read the complete question stem and the MCQ options to quickly get the idea what the question is about. Now, having the gist of the MCQ in your mind, do the second read more deliberately and slowly. Once you have truly understood the question, always consider all the options as probable answer and then eliminate them one by one. If you're sure about the answer, go ahead, attempt it. If not, then don't waste your time. Put a slight smudge on the answer you think is most likely correct, and also on the question number. Now move on to solve the other questions. By the end of the paper, either another question would you give a hint about the other question that you were a bit doubtful about, or you would have reached your conclusion, okay, that will be the answer. Putting a smudge is very helpful because at the end of the paper, if you don't have any time to reread and rethink, you just blindly go and color those smudges. This will protect you against unnecessary anxiety and panic mode we all face when the time is about to finish, and help you achieve top marks. That's it for today, guys. I hope you have enjoyed this video. If you found it useful, press like, subscribe, and press that bell icon as well. I'm Dr. Junaid, and I post videos about education, travel, and life of a doctor working in UK. Until next time, take care.